Go around with some quick introductions. I guess I'm especially as people on Zoom that we haven't seen before. I'm Roger Olson. I'm the chair of this board and I've been here for a few years. We'll just move around to, I don't know if you can tell where we're going, but we're going to the left. Yes, we can see.
Hi, Kara Cronin. I'm the program manager for Influence and Health Services.
Hi, I'm Stephanie Edsman. I'm a parent of a young adult who accesses services and a board member. I don't know what I am. Easy one.
Paul Partridge, I manage the intellectual developmental disabilities program here at Deschutes.
Matthew Christensen, epidemiologist here in Health Services in Deschutes County.
Dana Murray, I'm the administrative assistant for behavioral health.
Shannon Brister August. I'm one of the program managers with behavioral health. I oversee kids services.
Jessica Vieira, board member. Can you hear us okay?
Oh,
Okay,
Oh.
great.
no,
No?
no.
Should we speak up? Okay, go ahead.
Fucking
A
God.
little bit.
Okay, all right. Here we go. Good job.
I'm Julie McFarland, board member and also a parent of a child taking advantage of the Deschutes County services. Lorelei Krasanik, board member.
Okay, a couple people have notified me this week that they wouldn't be available today, and that was Captain Schultz from the police department and Christina Lee. Haven't heard from anybody else. It is just the end of summer. A lot of people are still out, I think.
Want to go ahead and introduce?
Oh, let's go up there. Start up there with
Peter.
Dr. Bohm.
Peter Bohm, board member, retired pediatrician, and Roger, I'll be leaving early, unfortunately, today.
Okay. Let's see, Saul, I believe that says. I don't have it. You read their name?
It's Sol Santos. I was actually at the mental health. What is that? I forgot what that's called, but the mental health fair at Drake Park. And my wife and I run a self-development company. So this is right along our alley. And so I'd like to find out what it's all about and see if I can be a part of this community wise.
Great.
Welcome.
Thank you.
I can't read their names from here, Dana.
That's okay. Kimberly?
Hi, I'm Kimberly Drew. I own a psychotherapy group practice in town called Mirror Pond Counseling. And Lorelei invited me to visit. And is Liz here? Liz, are you Galaxy A20?
I am. That's me. I didn't know it came up.
Awesome. Okay, maybe you can go next.
Okay, go ahead there.
Camera. Oh, hi everyone. I'm Liz Grotsky. I am a mental health clinician working for Mirror Pond. I got the invitation through Lorelei. I have a background in crisis work. I was a crisis worker in Jefferson County for approximately a year while I worked with Best Care Services. And I am exploring my options to see if joining the board would serve both myself and the community for the best. So I'm here to explore.
Welcome.
Jill?
I'm Jill Adams. I am a board member and also a special education teacher.
Kelly?
Hi, everybody. My name is Callie Remley, and I'm the behavior strategist with Pacific Source.
And Leah?
My name is Leah Gay. There's two Leahs.
Oh.
Yeah, I think just regular Leah. I'm Leah Rappaport, Director of Counseling at Cascades Academy, and I work with Jill.
Other Leah?
My name is Leah Gage. I'm an LPC. And at 1 o'clock, I have to leave because I am participating in the CIT training here in Redmond today.
Cool.
Great, I think that's everyone.
I was there all week. Couldn't be there today. Welcome, everybody. The announcements from the organizations, et cetera, what's going on out there?
It's great to see us on the Deschutes County meetings, so just saying, that was probably Dana that did that.
Okay, we need to get approval of the July 31st meeting, or 21st meeting minutes. Read them though. Everybody remembers back that far? Everybody had a good time in August not being here.
So move.
Thank you. Okay, moved and seconded.
Second.
All right. Get that out of the way. Hey, Paul, you want to tell us what's notes you got from the director?
Yeah, the notes that I have from the behavioral health director, Holly, are that we're going to take a pass on giving an update. I was like, you want to give me some points on, because we had some ideas of things to talk about. Rather than doing that, I'm going to take a pass on Holly's behalf. Other than to say that there's a whole bunch going on right now, even today, across town at the River House is where Holly is with a bunch of our other community. Oh, here they come. There's been some strategic planning for Association of Community Mental Health programs going on over at the River House today. So that's where a lot of folks are. There's also a mobile crisis training that's been going on, an academy that's been going on over there all week. Statewide, crisis workers from around Oregon have been gathering and getting some more information. Really solid training, the AOCMHP, that's the acronym behind Association of Community Mental Health Programs. AOCMHP has been putting on that academy, and that's really exciting thing to see. Crisis workers getting some really core training, including working with special populations, including IDD, intellectual developmental disabilities population. So just a couple of examples of some really big things that are going on right now. That's all I got.
Okay, that sounds great. Nice to know what's going on. Probably way ahead of schedule. But Jessica has been working with Dana and the rest of the team on some things for the onboarding project.
First, just let me welcome Sol and Leah. I met them at Balance Bin at the mental health fair. That was the second year, I believe, that fair has been going on. It was very nice. That's where I met these two individuals that might have an interest in joining the board. And that was also one of our community outreach opportunities. We had talked about doing 2 this year. So that was actually 1. So we're 50% in. So I believe there are 3 positions on the board currently. So hopefully we'll be moving forward. And then I would just like to pass out our advisory board on onboarding packet. And for those of you that are, can you see that? Those of you that are on the Zoom, I'll kind of go through what's in the packet as well so that you will not be completely left out. But this packet was developed in response to having some vagueness when we joined the board about what was our mission, what was our directive, where did we want to go. We know that we are at advisory capacity to behavioral health, but what does that really mean? And also a way to acquaint those of us who were not in the trenches or worked at Deschutes County to understand the breadth of the system. So starting on the left-hand side of the packet. And also, I just want to thank Dana, because without her, we would look like we were in kindergarten with crayons. And that's just the truth. That's not anything but the truth. So we do have a welcome to the board packet. I won't show you every page, but we like that. And everything has been vetted through
There you go.
the woman who speaks to all the media.
Whitney.
Yeah, and her position is,
Communications.
yeah, so all of this has been vetted through communication. So basically, we just give you a welcome from Holly. The board members are here along with their positions within the board. And then the contact information of the board members. List of acronyms, which is lovely because we need those. Also, there is a Deschutes County Health Services Organization chart to help orientate ourselves to, where are we on here? Are we on here? Well, to help orientate ourselves to the organization. I can't pronounce that, so I won't be saying that again. Also, our locations are in here. Let's see, the service continuum and the types of services that are provided. And there's more detail around that. It talks a little bit about our community and how this system is funded. And then there is the intellectual and development disability IDD services included. So that just gives a broad perspective of those that we serve here on the board. And then on the right side is what you saw at the Balanced Bend Fair. This was developed as part of our onboarding process and a way to get information out to the community and our newly revised bylaws that have been approved by county council and Holly, et cetera, et cetera. So this should really give folks that are currently on the board, as well as individuals that are interested in coming on the board, what our function is, what our values are, what our mission is, et cetera, going forward. What's nice about this is in next year, we can really rely on this packet in terms of identifying priority areas that we would like to explore and advocate for. So that is what I have. Any questions or?
I do have a question. How many people do we have on the board currently? And then how many positions are open or going to be open, and what's it considered a full board?
Okay, I'm gonna take a guess and then I'm gonna have somebody correct me. I think we have 3 open positions for a total of 15 needed. So we have 12 on the board. And I am just guessing based on what I read a couple of years ago around the board. So Roger, and I think they're 3-year terms.
That's what we just put in the bylaws.
Oh, is that what we, did I have it right?
At least 9 and not more than 15 individuals.
Oh, there you go. Perfect. And it is comprised of people with expertise, community members, families, that's community members. It's and we're looking to have a good diversity on the board.
And when you bring someone on from the month they start, is that when they're start? So you might find somebody and they don't start till March, March to March, or is it a calendar year?
No, it's 12-month. It's not a calendar year.
It's when they start. And then also, we did send this out for people to provide feedback on, specifically about how you would like to be addressed. So if you find that that is not your preference, please let Dana know. And then instead of making a whole new packet, we'll correct that page. So.
Or if you have any other suggestions or see any edits, just let me know.
So anyway, I really want to thank Dana and Christina Lee, Lorelei, me, Roger, everybody who proved it. This has been really our goal for this year and we met it. So that's good.
And also the photo on the front is Christina Lee's.
Oh, yes.
So I
Yes.
meant to put photos
Yeah.
on it,
So
so
this
I'll
is-
do that next time.
Okay, that's what I have.
Great job.
Yay.
Feels good to complete a project. Get this beautiful. And it's just a part.
One of the things that's been coming up in our agendas, future agendas and things that are a lot of questions around the opioid fentanyl, especially crisis that we're experiencing in the state, the nation, and the county. And as I look farther into that, it just is such a huge issue. And it's such a big problem that I decided it would be a good idea to break it up a little bit. So today we're going to hear from Matt Christensen, from the epidemiologist. Yeah. Not a word that comes up much in my engineering background.
Epidemics.
Yeah.
It's an epidemic.
And just to let us know what the situation is right now, how we got here. And then next month, I'm gonna have somebody from Sheriff's Department and also Sergeant or Captain Schultz. We're gonna talk about what's happening right now with his MTA program in the jail and what's happening with our harm reduction team that's working out in the public. And then the following month, we'll talk about what the future is looking like, because there is some funding that just can come through from the I guess the lawsuits against some of the pharmaceutical companies, and so
Opioid settlement dollars.
opioid settlement dollars, right? And so they've worked out a budget and a plan for the future, and I think that some of those things should be pretty much in place by November. It'd be a good time to move. So let us know what's going on in that. So that's the plan for the opioids, and I'd like to turn it over now to Mr. Christensen.
Matt, really quick.
Yeah.
You can share.
Share screen, right?
Oh, did you already do it?
No, I didn't.
Okay.
Well, when that's getting settled, I also want to thank Stephanie for her part in making all of that happen. I forgot that. So, sorry.
It is rough.
Which part she was in.
It's over.
That's right.
We found
In that team,
community. I know.
not in the
Surface, there we go.
there's bylaw team. That's right.
Oh, I think you did.
Sharing. Let's open it up.
There's a share up there. See it up in the top right?
Oh, it's not that one.
Oh, sorry.
Go ahead.
That's my skill.
Been trying to get a new mouse.
So it's open, it's just minimize screen, so yeah, we need it, there we go.
You probably want to confirm that folks on Zoom can see the presentation.
Can you hear me and can you see the presentation online?
Yes, I'm on here.
Yes.
Thank you.
Thank you. Regarding drug overdose in Oregon, I have seen the headlines. I'm sure you have all seen the headlines as well, that drug overdose mortality rates are high in the state, that there is a drug overdose mortality crisis. However, beyond the headlines, I haven't been able to get clear information about where drug overdose mortality rates are high and how high they are. Until earlier this year, I had the opportunity to get some help from an intern at Oregon State University. And we met in May and June for several meetings. We conducted a small study, which the results I'm going to share with you today. And it's a pretty simple, straightforward look to answer those broad questions. We've identified 2 or 3 drug overdose mortality hotspots in the state. Multnomah County, Wayne County, and the southwest part of Oregon. We're going to be looking at some maps of the state, and we'll be able to show you what that looks like in terms of the county rates, drug overdose mortality county rates. In addition to hotspots, what we've also were able to see clearly, and we're going to show it to you, is in terms of where is it increased, it is in those hotspot regions, but also immediately around those hotspot regions and across the entire state of Oregon to a lesser degree. The maps will show a lot of that. Across most counties, there has been an increase in drug overdose mortality the last 2 or 3 years. But certainly not everyone is increasing at the same rates by any means. There are some counties that have seen a spike in drug overdose mortality rates, and we're defining that as communities that have had low rates, and in a short period of time, primarily 2021, they saw their drug overdose mortality rate increase dramatically. I want to start with the big picture, and we're looking over the past 2 decades. These are drug overdose mortality rates for the United States shown by the blue line, and drug overdose mortality rates per 100,000 population for Oregon as well, shown by the orange line. It looks like it's kind of a brown line on our screen. What we're going to look at is where our big arrow is pointed. We have seen our drug overdose mortality rates more than double in 2 years. In 2020 and 2021, our rates ended up at the end of that year at 26 drug overdose per 100,000. We're going to talk about later in the presentation preliminary data for 2022, which shows this same trajectory of increasing drug overdose mortality rates happening. And so far we're in a 3-year period where our drug overdose mortality rates in Oregon are increasing at a pretty steep level. I want to draw your attention, however, to the previous 13 years before 2020 on this graph. If you look at 2007 through 2019, you can see that this section is largely flat. There's not a lot of change. We are at a rate of about 11 drug overdose deaths per 100,000, and we didn't see a lot of change. So for a long period of time, that's been our history in Oregon until 2020, 2021, and 2022, when things have really changed dramatically in the past few years. This is a map of the state of Oregon showing our 36 counties. This is drug overdose mortality rates for the year 2019. The next map is going to be 2020, and then we're going to look at 2021. I want to draw your attention again to the top left-hand corner where it says death rates. These are drug overdose mortality rates per 100,000 population. And we have kept these maps consistent for all 3 maps in terms of having 4 categories with the same rate. Yellow is the lowest category from 1 to 12 drug overdose deaths. Next, it's that orange category, death rates from 13 to 19, and then purple 20 to 30, and then drug overdose mortality rates above 31 deaths per 100,000. There weren't any counties in Oregon that were in that top category until 2021, when there were 8 counties that had rates over 31 drug overdose deaths. I also want to just quickly explain all of the counties that don't have a color assigned to them. We weren't able to calculate rates in those counties because the number of deaths was below 10, and the rates become unstable if our number of deaths is just too small. And so it's not an accurate comparison if you're calculating rates on really small numbers. because those rates end up looking really high, really low. And so that's what that means. All of the, primarily the eastern half of the state, there were fewer than 10 drug overdose deaths in all of those counties. That being said, about 90% or a little over 90% of all drug overdose deaths are in those counties where there was a large enough number of deaths to calculate rates, as shown by the counties where there are colors on the map. This next map for 2020, you're going to see that there's fewer counties with yellow and a lot more orange on the map. And so previously we had 6 counties with yellow. Now we have 3 in 2020, and a lot more counties are in this second category of 13 to 19 drug overdose mortality rates. And then we have 4 counties in the purple category of 20 to 30. Moving to 2021, you can see that now you're seeing 8 counties with rates above 31 drug overdose deaths per 100,000. And I'm going to talk a little bit about this slide and some subsequent slides to explain the primary results of this study we completed earlier this year. We're going to talk more specifically, and I'll show you on the map, our 2 to 3 hotspot regions. And we're defining a hotspot in terms of high drug overdose mortality rates in our state running for several years. These are counties and communities, when you look back for several years, they're at the top or near the top year in and year out. There is fluctuation for some of the smaller counties, but when you look across multiple years, Multnomah County, far and away the largest number of drug overdose deaths for several years running, year in and year out. Lane County also, it has high drug overdose mortality rates in Southwest Oregon. We'll talk a little bit about B in terms of the increases in terms of drug overdose deaths, primarily in those hotspot regions and around those hotspot regions. And then we'll talk about communities that experienced the spike. So Multnomah County had a rate of 42 drug overdose deaths per 100,000 in 2021. And Lane County was in the mid 30s. And the reason I'm saying there are 2 to 3 drug overdose mortality hotspots, it depends on if you want to include Lane County in this entire Southwest region, or if you want to think of it as 3 hotspots, it would be Multnomah County, Lane County, and then these 3 counties along the California border, Josephine, Jackson, and Klamath. Those counties year in and year out are having the highest drug overdose mortality rates in the state of Oregon. Douglas County is kind of a in-between county. They never had the highest rates, but they were always not far. And so it was interesting to see them on the map where Douglas County, where their rates were, they were always relatively high. They weren't the highest, but it seems like almost go between Lane County and these counties. So those are the 2 or 3 hotspot regions. And the increases primarily have been in those regions and around those regions. In 2019, I do want to move my cursor, but it keeps bringing that up on the bottom, but I think we can still see most things. In 2019, there were 301 drug overdose deaths in these 6 counties, including Multnomah, Columbia, Washington, Yamhill, Marion, Clackamas, and Multnomah. There were 301 drug overdose deaths. Those same counties 2 years later, 706 drug overdose deaths. And you can see that represented by the numbers in the county and the color of the county, how things have changed in that 2-year period around Multnomah. In the Southwest region, there were 143 drug overdose deaths in this region. 2 years later, 333 drug overdose deaths. So what we're seeing in this last 2 to 3 years during this time is clearly communities that have had for a long period of time, and in our state, the highest rates, and they're increasing during this time, but also communities that really haven't had high rates are now starting to see a lot more drug overdose deaths. Yeah.
Question in the chat, why is Curry so high?
Yeah, I'm going to talk about Curry in a minute. You're a little bit ahead of me. They are very high, absolutely. They had a drug spike in drug overdose deaths. They had the largest increase in 2021. Yeah, and then we will get to Curry here in a minute. Good question. Good question. So thinking about this in terms of the increase in a short period of time and spreading of drug overdose mortality, one of the things in epidemiology from a disease perspective and looking at population numbers and large numbers and how disease morbidity risk or mortality risk is moving through a population, one of the things that we want to understand is transmission and how's it spreading. And so it always looks different for different diseases. This is a very different application of this than COVID. That's our most recent worldwide example, figuring out how it was transmitted, airborne, person to person, keep 6 feet away, wear a mask until we can get population immunized and immunity. This is a very different application of that. Our maps are kind of looking at it from a community to community spread. But broadly speaking, this is what we're doing in the US and in Oregon to interrupt this transmission or spread of drug overdose mortality. So from a drug supply and a drug demand perspective, on the drug supply side, law enforcement agencies coordinating federal, state, and local law enforcement working to interrupt drug supply. On the drug demand, that's all of us trying to interrupt that, and that's a lot of different strategies: prevention, treatment, recovery services, Narcan distribution, long-term recovery from addiction, healthcare providers. And the last point I want to make is in this C category, drug overdose spikes. There were several communities that saw a steep increase in drug overdose deaths. Curry County, Columbia County, Marion County, and Umatilla County. I'm going to point them out on the map. They weren't the only counties that saw a large increase in 2020 and 2021, but they're the clearest examples of communities that had a spike in drug overdose deaths, going from relatively low rates to very high rates. Down here in the southwest corner, with their proximity next to these counties that have had high rates for a long period of time, Curry has not. Curry, until 2021, really did not show up on this map at all. And their rate in 2021 was 89 drug overdose deaths per 100,000. The next highest rate in Oregon in 2021 was Multnomah County at 42. So Curry had a rate that was more than 2 times higher. They are a smaller county. They have a population of about 23,000. They don't have a public health department, and so they don't have services. One of the questions that's come up in previous presentations is, do they have anything really in place in population distribution for naloxone, Narcan? And as far as we know, there isn't any public health agency that was providing services, whether that was a factor or not. Another spike community is Columbia County. It borders this now northwest border with Multnomah County, and a lot of the population for Columbia County is right here across the border, and not far from downtown Portland. They also had a rate that was very high in 2021. Their rate was 41 drug overdose deaths, third highest in 2021, right behind Multnomah at 42. And then Marion County also had a large increase. Their rate increased by more than 3 times in 2020 and 2021. And Marion County is a large county. This is where Salem is located, our capital city. And then out here on the northeast corner of Oregon, Umatilla County, this is Pendleton, also had a moderate spike. And when I saw this and when it located on the map, I wasn't sure exactly what was going on. Because, and so I looked into it a little bit, but Umatilla had a large enough number of deaths to calculate a rate, but Union County and Baker County also saw increases in that area. Interstate 84 rolls through Portland along the Columbia River Gorge, and then it comes down through Umatilla, Union, Baker, and then comes into Boise. Also right across the state line, we've got a couple of pretty moderate sized communities in Washington and an interstate that breaks up north here. And so this is kind of an intersection way that certainly could have a factor in why there was a spike in Umatilla and increases in Union and Baker out there in those really rural, particularly Union and Baker rural eastern counties.
395 and 84 sort of intersection.
Yeah, 395 is the one that goes north. Okay.
82. I-82 goes north.
Oh, 82. Yeah, I looked down on the map, but I've not traveled on it, and so I'm unfamiliar with that in terms of going up through Washington, but I did see there were a couple communities.
Tri-Cities is right there.
Cities. I want to show you now and bring in Deschutes County into our discussion where we've been at a statewide perspective. And Deschutes County is not a hot spot, has not been a hot spot for drug overdose mortality, and we haven't experienced a spike in drug overdose deaths. Nonetheless, our drug overdose deaths have increased in the county. If you only were looking at these numbers and you didn't know what was happening around us, this is concerning enough. Our rate almost doubled in this time period. In 2019, our drug overdose rate was 6 per 100,000. We have about 200,000 people in the county. And in 2021, our rate was at 11 drug overdose deaths. But the perspective, when you look at these other counties that have been highest for in our state for several years, this is Multnomah County. Year in and year out, they're about 3.5 times higher than us. And that's Lane County. And the rest of that southwest corner, that's Josephine, I believe, Douglas, Jackson, Douglas, and then Klamath County down in that southwest corner of the state of Oregon. So it gives you a little bit of perspective for us here in Deschutes County. Our numbers have increased, but we are not experiencing the brunt of it. We are right now currently focused on getting access to data where we can identify if our numbers are going to continue to increase and if they start to increase at a faster pace so that we can try and meet that and prevent mortality as best we can in terms of outreach. If you were to put Curry County on this map, it would really dwarf, and there was a reason I didn't put it on here. Their rate was 89, and it would be 2 times higher than any of these other counties on the map. I want to talk about drugs a little bit. We're looking at drug toxicology test results. So this is on the back end after the death, and we're getting results back from the toxicology tests, and we're seeing what drugs and combinations of drugs are involved in the drug overdose deaths. We're looking at 2 years of data. 2020 is shown by the blue bars and 2021 by the orange or brown bars. And I want to start on the left, and it will be clear what we're looking at as I walk through and explain it. At the top of those bars on the left, this is for any opioids. The numbers are 67 and 68. In 2020, there were 67% of drug overdose deaths positive for opioids in Oregon. 2021, 68% of drug overdose deaths came back positive for opioids, any opioids. The 3 most common opioids are in those next 3 categories: fentanyl, heroin, and prescription opioids. And you can see what the relative percent is for those 3 groups of opioids. Continuing to the right of center, it says any stimulants. And the numbers at the top of those bars, 57 and 63. 57% of drug overdose deaths in 2020 came back positive for stimulants. And then in 2021, 63% of drug overdose deaths. And then cocaine and methamphetamines are the two most common stimulants. Looking broadly then across the graph, you can see the two most common drugs that are coming up is methamphetamine and fentanyl. However, I've got my big bold box around fentanyl. And this is not necessarily a new story. This is something we've been hearing a lot about for many years, but it's new for us in Oregon. We've been hearing about it in other parts of the country and more broadly, US having increasing drug overdose mortality rates and fentanyl is driving it. We haven't seen on these toxicology test results fentanyl come in really before 2017, and there was only a few percentage in 2017. In 2018 and 2019, 14% of deaths came back positive for fentanyl for Oregon. And then on this graph, you can see 2020, it increased to 32% of deaths coming back positive for fentanyl. 2021, nearly half of the deaths came back positive for fentanyl. The data we're going to look at in a couple of minutes that shows the increase in deaths in 2022. Don't feel like I'm going out on a limb at all. We won't know this data until the year is finalized in December or January of next year. So we won't know exactly what those data look like, but based on what we have seen, this preliminary data, we're probably going to have around 60%. It's certainly going to be above 50% of our deaths coming back positive for fentanyl, somewhere around 60%, yeah.
So I work in California via telehealth, and what we're seeing there, and I'm wondering around your stimulants, is a lot of methamphetamine also having fentanyl in it now. And so part of the protocol is to actually put a person on MAT treatment for amphetamine because of the fentanyl in that. So in your calculation here, where you're seeing the fentanyl coming back positive, are you also seeing a combination of stimulants in these individuals?
Yeah, most often it is multiple things. And there's other drugs outside of these two classes, opioids and stimulants. Sometimes it is just one drug, but oftentimes it's multiple, many, and alcohol. Yeah,
I've seen primary a lot diagnosing with stimulant and fentanyl addiction.
We also have a chat if you want to open it.
Okay.
One.
Where are we at here?
Open that, yeah.
In the chat, I'm noting some of the counties with higher rates have high poverty compared to other counties. Is there a correlation there? I'm also curious as to what influence Proposition 110 and COVID may have played into the data. Yeah, good questions, all of which I don't have any rock solid answers in any of those areas. Undoubtedly, poverty is going to play a role. In Multnomah County and Portland, their drug overdose deaths were really atypical from the US and the rest of Oregon. We looked at age differences, and in Multnomah County, a lot more of their deaths are 55, 65-year-olds, and that's just not the norm. Across the US, it's mostly 30, 40, 50. And in Multnomah County, it's those age groups, but the highest rates were 50, 60, 65. And I don't know exactly what's happening in Multnomah County, if it has to do with houselessness or poverty, certainly is going to play a role. I've thought the same thing around the COVID-19 pandemic. These data are during this time period. The national rate, the graph that we looked at in the beginning, and we're going to look at it again on the next slide, shows that it's also spiking nationally, the drug overdose mortality rate during the pandemic. And Proposition 110, that question came up last week in the presentation as well. And I don't have any particular thoughts about 110. I don't know, it may have. We weren't sure exactly when it passed. in 2020. Is that when it passed? So.
I don't know, I think it was 2021, right in there though, for sure.
So I'm not sure. I wish I could give you better answers there. I do want to go back to my fentanyl though, because in relation to this increase, there is a very clear and strong correlation. And it is fentanyl. This spike we're seeing, and we've seen it in other parts of the country, it's the most potent opioid, lethal opioid getting mixed into an already dangerous combination. And it didn't come into Oregon until really in 2018, 2019, where 14% of our deaths were coming back positive. And now every year it's coming back at a higher rate. And so we've already talked about this graph a little bit, but I want to give it another couple of minutes, because this gives you a nice broad context as far as how things have changed in drug overdose mortality in our state and across the US. From 2000 to 2011, Oregon and the US were on the same trajectory. Our rates were very similar. This is the time when prescription opioids was becoming more accessible and larger doses, and was the primary driver of this increase in drug overdose mortality rates in this decade. And then we separate. In 2012, we were still kind of on this flat trajectory. We're hovering at around 11 drug overdose deaths during this time. And the US rate is continuing to increase. There have been several studies that have looked at the history of drug overdose in the US. And during this time, there were spikes in Philadelphia, Boston, the northeast part of the country, West Virginia, a lot of the bigger metro areas and populations along the East Coast was where they were getting an increase in fentanyl. They were looking at their toxicology results. And the CDC did a regional study which looked at this same issue. And the western part of the country, in these first years, 2012, 2013, 2015, there were no Western states where fentanyl was really even on the radar in terms of drug overdose mortality rates. And that applies to us here in Oregon. It really wasn't until 2017, and we only had a few percentage of our deaths. And then in 2018, but now one thing that these data are really clear about, because they're on the back end of this, and it's really quite undeniable, is that in Oregon, the last 3 to 4 years, there is a pretty stable network of fentanyl coming in that is supporting this. And it's seen on the back end in these toxicology test results. And that is strongly correlated with our spike. Again, this is not a new message. It's just new for us in Oregon, because it is for us in the last 3 to 4 years where things have really been changing. I want to talk about 2022. I've referred to it.
Just, I looked it up, Measure 110 went into effect on February 2021, so.
Oh, you're okay, you're a little bit later.
Yeah, so I don't know how much it would impact these numbers. That spike was already
Yeah.
well on its way.
Probably not.
Yeah. Sorry.
Thank you. Thank you. These are preliminary data for 2022. This was sent out by the Oregon Health Authority in July. We're only looking at opioid deaths. There is a national system that collects these toxicology results, and it's reported to the CDC, and we have this in Oregon as well, and they report their data out periodically. And so you'll remember that about 2/3 of deaths were positive for opioids. So we're looking at about 2/3 of the pie with these numbers. We're in terms of the total number of drug overdose deaths, we're missing about 1/3 every year. And so what it clearly shows, when I first saw these data, this was the first clear indication of, oh, well, it's continuing really at the same trajectory in 2022 in terms of this spike in drug overdose deaths that Oregon is experiencing. This number isn't going to decrease. It will only increase from this point. I don't think it's going to be a lot higher than 934. What we're waiting for is some of the drug or the death certificate data. to receive this toxicology test results. There's a few records waiting for those results to come and either confirm whether it was a drug overdose or not. And so they give generally about a year to close out this data. We'll know the final data in 2012, but this is a clear indication. Like I said, this number isn't going to go down, it's only going to go up. But at this point in the year, it shouldn't go up a lot more. So we are currently in the middle of it. We've really had 3 years where our data are showing a spike in drug overdose mortality in our state, 2020, 21, and 2022. Our numbers here in Central Oregon are also increasing, but largely we have not experienced what a lot of other communities have. We are currently paying attention to this idea of not wanting to see a spike here. And if we do start to see an increase, getting access to timely mortality data so we can identify it as it's happening and not 6 months later or a year later. So on that note, some really positive news, which I'm going to end on. We've been partnering with our medical examiner's office and reaching out to them, and they've agreed to share the drug overdose mortality data when there is a drug overdose death. EMS is on scene, law enforcement are on scene, and a medical investigator is on scene. They all have different jobs, different tasks, but the medical investigator is collecting information for the medical examiner to help make that decision about what the cause of death was in partnership with law enforcement. And they know within hours of, okay, this is suspected. They don't get those toxicology test results back, so sometimes they're not sure, but in most cases, there's evidence on the scene or clear indication of what happened. And so they call it a suspected overdose. They send off the sample to the lab, and then when they get it back 6 months or more later, then it's clear and they'll finish that death record. Anyway, we will be soon, hopefully in the next coming weeks, starting to receive this data within days so that we can start to track this in Deschutes County, and it's also going to be Crook County. We're working and talking with Jefferson County to see, they have a separate medical examiner's office to see if they can also start to look at their data in a more timely fashion. The only other option, part of this, well, the way this all started for me is we're getting data a year or more later. And it's still important, it's still valid, but for knowing where we're at now, it's just harder to use and if things are changing. If we're Curry County, for example, and our rates are increasing, we're not going to know until a year later. If what happens in Curry County were to happen here, it would be like us going from 20 deaths, drug overdose deaths, to 180 in 1 year in terms of getting to that rate of 89 drug overdose deaths per 100,000. That's the kind of, they're a much smaller county, so they saw a lot fewer deaths than that. But in terms of that rate per 100,000, that would be a huge jump for any community to go from that high. Thank you very much for inviting me to come speak with you. If you have any questions, any other questions, I'll be happy to try and answer them.
I just can't help but kind of state the obvious, and that is how many people are not dying by overdose, but have multiple overdoses that they're experiencing with fentanyl.
I think when my harm reduction team comes and presents next month, they'll be able to speak to naloxone distribution and data they have around prevented overdoses.
Yeah, that gets into the kind of the thing that was rattling around in my head during Matthew's presentation was, well, okay, so it feels like Deschutes has some protective factors that are keeping, even though the rates are going up, we're not experiencing what the hotspots in Oregon are. And so we need to really put an emphasis on recognizing what are those protective factors and keep doing or increasing whatever those things are, like probably harm reduction, prevention, others.
Services.
Yeah.
There's probably a correlation between access to services and those deaths.
Yeah, I've thought about this a lot. I think Narcan distribution, I think law enforcement, I think the Cascade Mountain Range. We don't have an interstate rolling through here. 97 is a major highway. I think there's many things. Farther distance is a factor from those hotspot regions. However, I think we're all seeing that fentanyl, we're seeing a lot of regular busts now in terms of law enforcement in the news of fentanyl pills. And it's pretty much, it seems like it's almost a weekly occurrence now in Central Oregon. We're hearing about it, seeing it.
I think you showed the state number percent was like 25.7 per 100. Right?
Yeah, it's right at 25.9. So yeah, 26.
Was Deschutes County,
11.
just 11 per.
In the same year, yeah, in 2011.
Back to kind of to Paul's point, like highlighting our protective factors and what we're doing well to maybe mitigate some of that and keep that, you know, and really highlight our preventions teams that are out there for public health and CARES team and the host team going out and Narcan distribution. I just think it's important that we pay attention to what we're doing well, that may be having a significant impact. Because 97 is a drug trafficking corridor. I mean, if you just look at our law enforcement, so I get that we're not on the I-5 corridor. We have a lot of drugs that go through 97. So I don't know, it's worth kind of diving into.
Yeah, and I mean, I just think it's a mistake if we looked at only one, like, you know, trying to remove the supply or reduce the supply, or, you know, if we only focus on one of those things, because, you know, you can't really eliminate the supply. It's going to continue regardless of what law enforcement or others, you know, activities are. You know, you're not going to be able to just do everything. So, I mean, I just think it's equal effort or continued effort in all of those strategies, all of those protection or prevention strategies.
Yeah, that one, where, you know, law enforcement and all the legal aspects we're doing. And then the other one, which was public health and behavioral health and medical, like to really look at what as a community we're about what we're doing to tackle it.
I think there's a parallel community, and I don't know if it's a great comparison, but Washington County, second most populated county, borders Multnomah County. Their rates increased, but they've come through this better than any of those other counties.
Notice that.
And they are a little bit higher socioeconomic status, education in Washington County, but their proximity is close. And I was thinking, well, what is it? And I think it is very valid to look at, okay, well, let's look at law enforcement and then the prevention, the treatment, and distribution, Narcan, the services, and recognize and credit and support those things, because there's a very good chance that Washington County has had some success in some areas, and we probably have too. I'm just surprised that they've come through this with their location. No one else in that area has been able to keep their rates. I think their rate in 2021 was the same as the Shoots, 11 or 12.
Well, I could speak to the shielding factors of some of those other things. So it's not all about proximity, you know, that's the disease transmission, right? That makes this epidemic different from other.
I think on the other end of that, I can't figure out why Klamath County fits in with Jackson so much. Because there's mountain range in the middle and they're much more rural.
I think that speaks to that 97 corridor, to be honest. And right there is that interchange where you're going to go down into Nevada, or you're going to, I just think there's a lot of traffic that goes through.
There's a lot of crossover between those communities, like a lot. I know.
Jackson, Klamath.
Yeah, Grants Pass, Medford, Klamath Falls, several smaller communities down there. Right on the state line.
Question, on the slide, it said it was measuring unintentional overdoses. How do we define that compared to the person who knows exactly what they're doing? And I'm just picking, you know, that 50 or 60 age group who just says, I know exactly what I'm doing and this is the way I'm going to do it. I mean, how do we distinguish between the two? And if mental illness is increasing, are some of those people using the opioids as a,
Yeah, very good question, very valid question, and I'll answer it the best I can, but I think it's not a perfect answer. Because it is an open question in the field. We can only know so much. So at the time of death, when law enforcement are on scene, medical investigators are on scene, they're looking at, was this a homicide? Was this a suicide, or was this an accident? And there's kind of a hierarchy there in terms of, and there's different actions that's going to happen with each of those. And so if there isn't evidence of a homicide or enough evidence of a suicide, anything clear, the default category is accident. Because they're not going to make a determination about intent if there isn't clear evidence to support it. And so it's an open question. Well, how many of these accidental, unintentional drug overdoses may have had? We don't know. A couple of studies have looked at it, and there's been estimates of 20 to 30% possibly several years ago. But it's just not really known in terms of. But that's how it's done, and that's why it's done. We're only looking at those drug overdose deaths where the intent was determined to be an accident, and then there's a middle category of undetermined. They're also included in this group. If it's intentional, we talk about them as suicide deaths.
we have some additional questions in the chat.
In the chat from Kimberly, where are people getting the fentanyl? Or are you going to cover the accountability on pharmacy companies and some of the lawsuits? Do you know if they have successfully regulated doctors with fentanyl after what happened with codeine a few years back, prescribing breakthrough treatments? I can speak broadly to this in terms of pharmacy and distribution of prescription opioids. Fentanyl 10 years ago was largely coming from China as source. Now I hear, and probably the same source as you hear, it's coming from Mexico. And there still sounds like there is some involvement with China from source materials, but it's coming up from Mexico as far as I know, and being distributed through networks. In terms of pharmacy companies, there is a national system monitoring opioid prescriptions now that's been in place for several years. And it had a dramatic impact. And still is. It really changed the landscape of opioid prescribing in terms of monitoring closely when there was a death, and they would track back and they would look at specific prescribers and if there were multiple deaths and the number of prescriptions. And so that system has been used across the country. Every state has one. In terms of monitoring opioid prescriptions. And so now in our toxicology test results, we're seeing a lot lower percentage of prescription opioids than we did 10 or 15 years ago. So that's largely changed. How many of the people are native versus implants to Oregon? I have no idea in terms of whether if they were born here, their residency status. What we're looking at and what we've talked about today are people who are residents of the state of Oregon. These drug overdose deaths are not people coming from out of state that died here. We're only looking at people who have residency status here. And if those residents died from a drug overdose is what we've
Here somewhere recently that fentanyl is like $10 on the street.
Let's see what Dr. Google says. I'll get back to you.
Yeah, I don't know. You do know, and you do hear though, that a very small amount has very large impact. And so I don't know if $10 is
Right. I don't know how much that quantity was or anything, but yeah.
Very.
Thank you very much.
Thank you.
Oh, that was great for a job.
I have another question. Can I ask? Can you hear me?
Yes, go.
Okay. One of the things I've always thought about, and this is the perfect place to ask the question, is about money allocated to mental health. The system just seems so exhausted every time I interact with the jail, or seeing how much a licensed professional is making through the state, which doesn't seem like enough really for burnout purposes. And just looking at it from that point of view, and then seeing where tax money is allocated. For example, with marijuana, there was hardly any, and they didn't realize how much, with Measure 110. That's why they did Measure 110, is because my understanding is that they didn't allocate money to mental health. So in Oregon, I would be really curious to see if anybody's dug up the numbers of how much money is allocated from the tax that came through marijuana now, and how much money will be allocated through the tax that, say, comes from psilocybin and all of the fees that are going to be coming in from that, and not letting that happen again, where a lot's going to law enforcement. Well, we already have law enforcement. What about like paying somebody to do mental health treatment so they're not burned out, and the system is given a little bit of a boost in that? I mean, I would like to see the comparison between how horrible it was a few years ago. We weren't putting any money into mental health, and now we're putting a little bit more, but are we putting enough in? I do not have any information on that, and I would love to know.
I don't have any clear information on that. Regarding or similar to that, I do know that opioid settlement dollars have come into Oregon and also into Central Oregon, Deschutes County. We've been having a couple of meetings with our county commissioners about opioid settlement dollars that are available, and we are looking at how those money could be spent to help with drug overdose prevention and treatment. But I can't speak more. I'm not the right person to, but I know it is in process, Kimberly.
That's just one pocket of money, that opioid settlement money, and that's going to be our discussion in November. But if you want to go ahead and see a preview of that, the August 30th meeting of the Deschutes County Commission, Board of County Commissioners, and you can get it online and watch. I think it starts at like 23 minutes in, goes for about an hour, just explaining what the plan is for those opioid settlement dollars. Overall, it's obviously not enough. What we're getting more than we have in the past. If you could kind of frame that and send it to me in an email, I'll see what I can find through our state NAMI board, whatever, director, and he'll have those numbers because he lobbies those things all the time.
So that's where I find the numbers. It's not like published anywhere. I'll go through you.
Well, it's got to be published somewhere, but I don't know exactly where.
I think if you look up burn funding, you might find some answers. Deschutes County, not Deschutes County Health Services, but Deschutes County, many organizations got about 11 million from the Measure 110 burn Behavioral Health Resource Network dollars.
And that 11 million hired about 25 staff at
For us
there, and then
there's other
agencies.
organizations.
So like hired like about 40 to 50 people within Deschutes County. $9.40, Roger. $9.40. $139 a gram. Not very much money.
$10, $9.40.
$9.40. Yeah, it can go up to $40 for street value, but $9.40.
It's still cheap. It's cheap.
Great value.
Great value. Thank you very much. Good meeting. Yeah, great. Thank you.
Great presentation.
Congrats to your intern too that helped you with that.
I was very happy to get that. I've been wondering about this for a while.
Yeah.
I had the
Okay, thanks everybody. With that, we're
Thank you.
for time.
I know where to get one if I need to pass.
Oh, yeah.